On today's World Insight, alarm over a second COVID-19 wave, the preventive measures taken as the US and Europe struggle with the rise in confirmed cases. And the sounds of old Beijing life kept alive in a museum. Why they matter, in the words of a Chinese-British artist.
They mean a lot to us now here in China.
Here is our host, Tian Wei.
Hello and welcome to World Insight. I'm Tian Wei in Beijing. We begin today's program with the latest on COVID-19. New cases were reported in China's northern province of Shandong. The province's biggest city, Qingdao, posted 6 confirmed cases and another 6 asymptomatic carriers over the weekend. The city of about 9 million people plans to carry out coronavirus tests on all residents within 5 days. Worldwide, the number of confirmed cases is approaching 38 million. In Europe and the US, many medical experts are sounding the alarm over a second wave of infections. For the latest situation related to COVID-19, we are joined by a strong panel in Providence, Dr. Megan Rani, emergency physician with Brown University. In Seoul, Dr. Alice Kim-Kyung-Tan, internist at Ms. Medi Women's Hospital. And in New Haven, we invited Xi Chen, associate professor of health policy and economics at Yale School of Public Health. Welcome to the three of you. The situations are not necessarily getting better, but rather getting very challenging. Dr. Rani, I want to begin with the United States. According to the latest report, it is suggesting that for every 2 Americans that have lost their lives in COVID-19, there's actually another one that is underreported. How do you see reports like this? Should we rely on these reports, or should we rely on the so-called official data?
It's a really difficult question to answer right now, Tian. We certainly fear that we are undercounting and underreporting COVID-19 across the country. As you know, we still lack adequate testing, particularly for some of our more vulnerable populations, as well as for folks in rural areas. And the diagnoses of COVID-19 after death, of course, require our coroners and medical examiners to do the testing and make the accurate diagnosis. Unfortunately, many of our medical examiner and coroners offices are overwhelmed and underfunded. So it's really difficult to know how true that report is. But what we do know, without a doubt, is that we are certainly undercounting the impact of this virus on the health of Americans.
Meanwhile, we have seen, Dr. Kim-Kyung-Tan, a situation around different parts of the world that's not necessarily encouraging. For example, in Europe, I know you are based in South Korea, but I also know that you have been following the picture worldwide. How should we understand the dramatic increase of numbers in Europe, in the UK, in Spain, in Italy, in Slovakia, and even some of the countries that used to not necessarily high on the list of deaths or infections?
I think what we're seeing is rebound after they loosened their social distancing and lockdown measures for the summer holidays. People were tired. They were very eager to go and travel, to eat in restaurants, to sort of resume normal life. But COVID-19 was not permissive, basically, in terms of letting people have their normal lives and having COVID-19 under control. And so right now what we're seeing is a rebound in cases, places like the UK, the Netherlands. The number of daily new cases is soaring, and I think the UK, they're looking at lockdown again.
Yeah.
Here in Korea, we've sort of resorted to finding ways of living with COVID-19 in our daily lives, and so that's our policy, is social distancing in daily life.
I see.
We have accepted that COVID-19 is not going to go away, and so that's been our policy, is to try to find ways to sustainably keep our society moving while keeping the virus suppressed.
Yeah, I also understand in some of the other Asian countries, countries are also fighting on a daily basis, and the picture is not necessarily that promising. Dr. Chen, you're based in the United States, but at the same time, I'm sure you also look at China's number. For the very first time in 56 days, China has had several cases, 6 mainly confirmed cases in Qingdao, a ski resort city of 9 million people, and also 6 asymptomatic cases in the same city. Now they're talking about a whole city testing of 9 million. Tell me about your response to the latest news from China.
The patient was coming from abroad, and he or she was receiving the care and the CT scans in the hospital, but without proper measures to avoid infection, and that was brought to larger number of cases, now double digits. But still, it's a flare up. It's imported case without a vaccine, so we need to stick to the non-pharmaceutical interventions, meaning the large-scale testing, contact tracing, isolation. So I think the testing of the city would be helpful, because this is based on large-scale testing. And the testing will give us the number of the positivity rate, which is very important, because that will guide us where the epidemic is and how severe the issue is.
9 million people, that's the population of Qingdao. Now the government has vowed to do the testing of every one of them within 5 days. We're already into the into the second day of the 5 days. And meanwhile, we also know about 4.5 million people traveled to Qingdao during the National Day holiday. Now, how is that going to have an impact on the overall picture for China's prevention and control COVID-19? It's a big question mark. When I'm saying this, I'm sure Dr. Rani and even Dr. Kim Kyung-tan, you are amazed by the fact that China is going to test a city of 9 million because of 12 cases. But that's how China has been doing it, and so far it has been successful. The reason I'm saying this is not about China's so-called record, but rather it's about how we can look at the latest COVID-19 threats and challenge, and how internationally globally can we work together. Now, Dr. Rani, do policy still matter? Now, with the numbers really rising in United States, in some parts of Europe, people are having this fatigue, and some people are having the thoughts of giving up. They would say, why don't we just have, herd immunity? Anyway, I can't live like this anymore. Now, is that a choice? What should be the policymakers' choice or choices?
So I think there are a wide range of choices, and great policies both allow for control of transmission of COVID-19 and at the same time allow people to get back to some semblance of normalcy. So with policies like universal masking or keeping indoor restaurants at maybe 25% capacity, you can minimize the spread of COVID-19, but still allow people to go back to work, allow children to go back to school. It doesn't have to be an either or. And I think that I and any other behavioral scientist, again, I'm an emergency physician, but I'm also a public health researcher, any of us would say that we know from a behavior change standpoint that those types of draconian lockdowns are simply not feasible for most people, certainly not over a long period of time. So if we expect to control COVID-19, we have to do it with a little more nuance and based on the science of behavior change. And great policies will help us do that. Of course, policies alone are never enough. You need to accompany policies by education, by having influencers who give positive messages, and of course by making it really easy to do the right thing. You have to make it easy for people to wear masks. You have to make it easy for people to get tested. And you have to make it easy for people to stay home if they or their children or their parents are feeling sick. And in the societies that are doing a good job of controlling this virus, they're doing all those things, allowing the economy to reopen, while also recognizing that it's really tough to completely eradicate COVID-19 from our society, and that really can't be a realistic goal.
You're based in the United States. You have a presidential election season. And unfortunately, that also coincides with the coming of the winter, which could be a big threat for COVID-19 for the overall population. Now, we all know in the U.S., mask has become a very political issue. You have a president, very unique. Now, he is on the campaign trail already without masks, talking to his supporters, even though the White House doctors suggested that he's been having negative results in the testing for consecutive days. But Dr. Rani, once again, I asked about policy from now until the end of the presidential election season. There's likely to be very different messages in the society, even coming from the administration. So how do you think that's going to work? And as a public health, as you said, expert, what can you do and your colleagues do?
So I do think that we need to recognize that we are unlikely to see any large-scale leadership from our executive branch between now and November 3rd, and possibly not between now and January 20th, whether it's for increased production of personal protective equipment, increased testing, or messaging around masking. At this point, what most of us are focusing on is on the individual states and on our state-level responses. You know, in Rhode Island, our governor has been tremendously effective in putting universal masking protocols and policies in place, in controlling movement of people from high-risk states into ours, in making testing easy to access, and in providing support for businesses that are struggling with current regulations. Our governor's just been stellar. And I think if we can see that across the United States, then we have a hope of controlling this virus despite the impending election and whatever it brings. I don't think that we can just throw up our hands and say that we're not going to try just because we have an election in about a month. Similarly, we can't wait on the national government to act right now.
Our salute definitely to those regional leaders inside the United States who are making the right decision for their peoples. And Dr. Chen, if I could, you heard from Dr. Rani suggesting some practices may be used in China or some of the earlier countries who caught with COVID-19 and then become quite successful in control and prevention would not necessarily now work anymore in the U.S. or in some of the continental Europe. Your take about that, the different ways of dealing with things?
Yeah, so at this stage, it becomes more and more difficult to implement widespread and large-scale lockdown or takedown of those measures. So those measures have to be smart and has to be targeted to those who are most vulnerable and who are most needed those protections. So in the United States, like more than 40% of the population have all kinds of obesity, and diabetes and hypertension. So even in the younger generation, so they are not risk-free. So and even besides that, most recently, this morning, the news from the U.S. study shows that this virus can be reinfecting people, and they identified a clinical case for a person aged 25, and he was contracted 2 different strains of the virus. So when we talk about those strategies, we need to think about whether this is feasible towards a virus. We still don't know quite much about it.
Complicated, that is for sure, isn't it, Dr. Kim Kyung-tan?
Yes, it is complicated, and so the approach has to be multi-pronged. I completely agree that we need a risk-adaptive approach. We have segments of the population that we know are at highest risk for death and for serious adverse effects. And so how do we target our protective efforts to try to keep them safe? Not just from COVID-19, but from all of the other psychosocial isolation and other sequelae, so to speak, of living with COVID-19, being in a somewhat isolated mode. At the same time, you have to keep the prevalence, the overall prevalence of the virus suppressed in your society. Otherwise, because of the large numbers of asymptomatic carriers, it can spread very easily under the radar. It spreads, it bubbles under the surface. And then all of a sudden, once it gets to a certain threshold, we're not sure exactly what that threshold is, but once it gets to a certain threshold, you see an explosion of cases, and you just cannot have that happen. So it's both a specific targeted approach to certain populations, but also in the general population, you have to make sure that the virus is suppressed. The SARS-CoV-2 virus, COVID-19, is a very tricky disease, and we need to be very creative in trying to find ways around it so that we can get ahead of it and prevent big outbreaks and big situations where a lot of people are dying of the disease. That's the goal, is to prevent morbidity and mortality, to prevent death and also disability due to COVID-19.
Yeah. Now, COVID-19 fatigue, it's not only happening in countries that have been severely hit, for example, the U.S., some of the continental European countries, but also here in China. I'm sure in South Korea too, in Southeast Asian countries as well, because we've been hearing about that, looking at other countries and be careful and not be able to travel beyond borders. All of this are necessary, but when it's a long time practice, it's certainly getting into the socio-economic impact that many of you have been talking about. Having said that, though, what can we do now? There is issues like COVAX, with 171 countries and regions joining in among the vaccines. But we know even with COVAX becoming a total success and having adequate vaccines by the end of this year, early next year, the biggest possibility we have is only 20% of the global population having access to vaccine by the end of 2021, which is far from a natural so-called herd immunity of 70% in order to avoid further deaths and spread of the disease. So we're so far away from there. From now till then, until much later, what can we do together? With the winter coming, many are having this question in mind.
So my first and strongest answer for what we can do is universal mask wearing. And of course, people who are sick stay home. But if everyone is universally masked, you can decrease transmission of the virus by somewhere between 60 and 90%.
Wow.
That's just a tremendous impact on the global burden of disease. So that would be my first thing. The second thing that we can do is to support each other. You've mentioned the psychosocial effects of this disease. They're very real. We certainly have seen anecdotally many folks coming into my emergency department who are feeling more anxious or lonely or sad because of the isolation from COVID-19. And so the second thing is to create those virtual communities or to create the small, stable pods where we can reach out and support each other, whether it's through church or through scouting activities and youth groups, or whether it is through local community groups. There are ways to have small groups of people who only see each other and who can look out for each other to make sure that they're okay. So there are simple things that we can do to get through this winter successfully. I would love to see international cooperation as well around both public health measures, ranging from testing through quarantining procedures, through vaccine distribution. Of course, as you and I have discussed before, the United States is currently pulling out of the WHO, but I am hopeful that we will see increased international collaboration in the future.
Well, there's a lot of questions in front of us. I really hope we could use our utmost efforts together in order to solve at least some of them. Thank you so much for your expertise, Dr. Megan Rani, Dr. Alice King-Kyang-Tan, and Dr. Xi Chen. Really appreciate it. Be well and be safe. Thank you. You're watching World Insight. Still to come on the program. Shoot for the ear and aim for the heart. The mission of a Chinese-British artist who keeps the sounds of traditional city life alive in his museum. Stay tuned.
I have to record different people, different pigeons all the time to get the right recording.
Welcome back. This is World Insight with me, Tian Wei. Next, we follow an artist to take a closer look at this unique collections of his. Colin Siyuan Chinnery is a British artist as well as a curator. Though born in Britain, he has deep connections to China. He spent college years studying Chinese culture, and he returned to Beijing, where his mother was born and raised, embarking on a sound project back in the year 2013. Street hawkers calling out their wares, chirping cicadas and pigeon whistles. The lost sounds of traditional Beijing life can be still heard in Colin's museum. Before we began our conversation, we did listen to the neighborhood noises that have completely disappeared, though, in the city.
So this was my first foray into sound, my first project. And what it does is it really explores one particular aspect of Beijing culture, and that is the commercial sounds, the sounds of selling things in old Beijing before 1949. So you can hear recreation of an ambience according to season, or hear individual sounds.
Right.
So
let's go with the individual sounds.
Let's first listen to the only sound that we can still hear in Beijing today.
Okay,
it's called the Zheng Jing Gui. When you hear it, you'll know what I mean.
Oh,
right. So you know what this is, right?
So the one who is sharpening the knives and everything, huh?
Yeah, that's right, that's right. So there's several metal plates placed together, strung together, and when you wave it like this, then it's like fish scales.
They clap one
They clap, yeah. Another one, very important sound that's no longer extant now, but was extremely important, is this.
Beautiful sound.
Yes.
I've never heard it.
This twanging thing is called a huantou. And what it was is the barber.
Oh, I see.
The barber.
Calling out everybody to come out and have the haircut.
Now, this sound still existed about 15 years ago, but now it's completely disappeared. But it was really important in Qing Dynasty because in those days, men all had to have the front of the head shaved.
Exactly.
So this started off as a military, order, an edict from the emperor. When you heard that sound, every man had to come out and have his hair shaved at the front, right? With no exception, it was the law. And then eventually it just became the sound of the barber.
I see.
Yeah. So do you want to hear some singing sounds, hawking sounds? Yeah, okay. So
your favorite one, maybe.
Okay, okay. So let me see. They sell all kinds of funny things.
Oh, all the snacks, right?
Yeah. So this is a midnight snack.
Midnight snack.
Midnight snack.
I hate those ones because they usually make me fat. But anyway, go ahead.
There has to be a rhythm to it that people recognize.
Right.
And then, so they know what's slack.
Yes. So they're like living in their own courtyards, right? They're not walking out, but they can hear these sounds from the hutong, and then they can judge whether they come out to get the bowl or not. Oh,
exactly.
That's nice. you were telling me earlier that very few people that could still sing these things, right?
There's only one person left in Beijing. He's 95 years old.
Wow.
I've been recording him last year. I recorded him a few times, and then I became busy with other projects, and I wanted to come back and record the rest of his repertoire. But then the whole COVID-19 started. Yeah. He's the only person who actually sold these things for a living to make a, he was in pre-revolution China.
I really enjoyed every sound in this magical machine. I hope there will be a longer list of sounds in the future.
I'm going to update it this year, hopefully. Again, I was disrupted by the pandemic, but I've already got everything prepared, a lot more sounds to put in here, including pigeon whistles and all those things.
I'm looking forward. The pigeon whistle up the most. Colin has a unique approach to appreciating the city of Beijing. Kickstarting the project in 2013, Colin worked to record the sounds of traditional city life before they disappear altogether. But it has never been an easy task. In our conversation, he explained how hard it is to capture the most vivid sounds. It looks like you like sounds, don't you?
Yes, I'm very interested in sounds, yeah.
How many sounds have you collected from old Beijing?
I haven't counted really, but I think it must be over 100, somewhere around that. It's really it's in its early stages, so I've collected not that many sounds, but there's a lot more to do. So I'm really just at the beginning of the process.
Among all the sounds, what are the sounds that you like the most?
I think it's the sound that's probably my favorite sound memory of old Beijing, or not old Beijing, but Beijing of my when I was younger, pigeon whistles. The way that Beijing people keep pets is not the same as like in the West, have dogs and cats and things like that. Beijingers, they like a different kind of other way of relating to pets, and sound is one of the most important things for them. Songbirds and insects that chirp, and pigeon whistles. Well, I mean, people all around the world, there are pigeon fanciers.
Yes.
Right, all around the world, and they raise pigeons. They breed very beautiful varieties of pigeons. But in Beijing, they make pigeons sing using whistles. What they do is that they attach whistles on their tail feathers, so that when they fly in the air, the wind from their flight creates the whistle.
The chorus
sing,
of
yeah.
sounds.
And the whistles themselves are very complex. They're not just a simple whistle. One whistle might have as many as 15 or even 20 smaller whistles attached. So when you have several pigeons flying in the air, there are deeper sounds, there are higher sounds, and it creates a kind of very complex sound. I made one good recording, but it still wasn't perfect because the season wasn't quite right.
What has to be the season?
Winter is the best season. The pigeons, they can fly a long time without getting tired. Summer is impossible because they're actually changing feathers. So if you attach the whistle to their tail feathers, they might just fall off.
This is really a comprehensive project. You have to know all the subjects in order to put them together.
And anyway, they're too hot. They can't be bothered flying.
Yeah.
So the best season is winter. And I did this in spring, where it was getting warmer. So they flew for 10 minutes, 20 minutes, and they couldn't be bothered, and they went back into their coops. So so I have to try again this year.
So you have to court the pigeons all the time.
Yeah, I have to court different people, different pigeons all the time to get the right recording.
It's not just the sounds, but the things related to the sounds, the people we've met, the ambience, the taste, the smell, the everything. What are they to you? I like the idea of a medium that can communicate quite directly on an emotional level. And that's why I started exploring the sounds almost like a part of history. And I also get a lot of people who come up to me and they hope that I can record sounds that haven't been recorded before. Or dear to their hearts, right? Yeah, dear to them, yeah, exactly. And that's why the next phase of my project, I want society to participate in what my project is called Sound Terminus. And the public can contribute.
Exactly.
Colin's deep connection to China comes not only from his studies of Chinese culture, but more importantly from his roots. He told me some very interesting stories about his family. Family history.
That's right, yeah. So I guess we should start with my great-grandfather. It's my maternal grandmother's father, Lin Pupeng. So we can see the difference of his attire when he was a government official in the Qing dynasty, when he was wearing, Qing dynasty robes, and then after that, after the revolution, in the Republican era, he was a government minister, and then eventually turned into a very different kind of looking man. And this is really his house.
And he is the one who introduced the whistle, the police whistle.
That's right. Yeah, exactly.
That I could remember.
We're very familiar with that. And here's a kind of cute photograph of my mother.
So this is already the courtyard, right?
This is already this courtyard.
Yeah.
And when it used to be a garden, and my mother riding a donkey and looking very happy.
That sounds fun.
Yeah, yeah.
It also shows the size of the courtyard, quite big.
Yeah, yeah.
A donkey could run.
Exactly.
So the grandma, grandpa, of course.
That's right. This is already in the 50s when they're living in London. This is somewhere in Europe, don't know where.
Yeah.
And here we have a photograph which is interesting. This is the last days of my grandmother's life.
Oh.
She was
There's
already...
the grandma.
Yeah.
Your mom.
Lin Fuhua, my mother, myself. This is in 1990. And this was just a few days before she passed away. But when she was wheeled into this courtyard, which didn't look anything like the courtyard that she grew up in. It was already it was a nursery school. We saw these kids.
Right.
Most of the buildings were already not there anymore. But as soon as she came into this courtyard, she said, "My mother's calling me for dinner."
Wow.
Yeah.
That's amazing.
So she just knew, her childhood memory came back to her. She knew she was home, and she had a memory of her mother calling her for dinner.
That's amazing.
Yeah.
And you were working very hard in order to get her settled into Beijing, and also...
Well, this was when she was in the hospital. So
Yeah.
this is 1990, and she was, she was already in hospital last days. Well, in Chinese we say 落叶归根, the leaf falls down back into its own earth. So I was only 19 years old then. So most of the work was done by my mother.
That must be quite an experience or a moment for you, huh?
Yeah, I think it was very, it was interesting because also when she came back, I realized that she was very important because all sorts of people wanted to be involved.
You didn't know that beforehand.
I knew she was famous, but then you don't know until you're in the situation, and everybody wants to be involved somehow, and it became very complicated.
Yeah. I know what you're saying. Exactly. Yeah. And this is the courtyard we just have been, is the one that hosted so many people.
That's right, yeah. Back in my great-grandfather's days, these famous people like Qi Baishi and Chen Shizheng and all these people who were
biggest names of our time.
They were frequent visitors. My grandfather, he had friends both in the Western intellectual circles and in China's. And of course, we all know people like Hu Shi, Xu Beihong, Xu Zhimo. So these people used to be part of
Chinese literati.
Yeah, be part of their intellectual life here.
There's some amazing
Bernard Shaw,
international figures.
That's right, yeah. Tagore came to this courtyard where my grandmother hosted him.
Okay, this third generation.
Yeah, in Chinese we call it 一代不如一代.
You really think that way?
Yeah, well, it's hard to live up to their achievements.
Yes,
so.
yes.
So I won't try.
Finding identity has always been the theme of your projects, it seems. But you yourself I'm sure you've been asked that question for many times. The identity issue is also an interesting one. This courtyard, for example, we are sitting in, belongs to your mom and your grandparents on your mother's side. And they are some of the most influential cultural figures of their time. So how do you see your own identity vis-a-vis their generations and what they created?
I don't see a direct creative lineage between my grandparents and myself. I think they lived in they lived in a completely different era. And I didn't grow up with them. So I don't have a direct, let's say, you know, inspiration, relationship with their lives or them living with them from a family perspective or an intellectual perspective. The other thing is that I'm not a big fan of attempting to bask in your, you know, ancestors' glory.
Past glory, yeah.
Yeah. Although I can take pride in the fact that I come from this family.
Of course.
There's nothing wrong with that. And it's really nice to know that my grandparents made, you know, an impact on the intellectual life of their time.
Their generation being considered by many here today as quite significant, and certainly the lives of their generation as a whole can be described as turbulent, but certainly exciting in retrospect. How would you see our generation vis-a-vis theirs?
They went through the Second World War. They went through Civil War. They went through incredibly momentous periods of history. Right now, we're at peace. At least we are. I think how to find yourself as an individual in this world that is like becoming so complicated without being at war is one of the most interesting things, I think, as an artist. Because on the surface everything's calm, but at the same time you know that it's not, and what that means for you and how do you relate to that as a person. We all know that the politics of the world is becoming very polarized. So we know that something is happening. And it's very easy to say, oh, it's because of this, or it's because of that. It can't be just because of one thing. It's a whole complex issue of eras changing or merging or splitting apart. How that relates to you as a human being when you need to feel grounded in a creative practice or in a certain identity, or what even identity means. That's the complexity of right now.
People talk about China, and a lot of those are stereotypes, but a lot of those are also things that Chinese or people here in China, including you, that have not been thinking much about. So it's kind of interesting as to, should we think more these days about what we are experiencing and ourselves in the context, or should we continue to move on with the speed and the rhythm we used to have?
I'm only saying I can't talk about society at large because it's way too big for me. But I can talk about myself because I think I face exactly the same issues as the rest of society. It's like, what do I do to ensure that I survive professionally and do something that I feel that I can enjoy for a long, long time? Not just in the moment, just now, and then make a lot of money and then think about what to do next.
Let me just pull in, once again, your grandpa's generation. They face a lot of questions for the very first time. For example, whether to learn from the West, what to learn from the West, and where is their future, in their home country or outside. They certainly give their answers. But a lot of these questions that they didn't have a definitive answer of their generation coming back to us again.
Well, one of the reasons why I think this generation, the generation now, finds the Republican era so interesting, and the writers of that generation, my grandparents' generation, so interesting, is that I feel that China has two traditions. One is Chinese traditional culture that goes all the way back to Confucius and the pre-Qin era philosophers and all that. That's the Chinese traditional culture. But we don't live in traditional China. We live in modern China. The other tradition that I think is very, very closely related to modern China, who we are in China, is the Republican era. That is, in a way, that's where we come from. A lot of our thinking, a lot of our lifestyles, a lot of why we think the way we think.
And the language we speak.
And the language we speak, the clothes we wear, everything. So much of who we are in China now comes from that Republican era. And that's, in a way, our roots. But very few people frame it like that. But it is true. And so that's why it's so interesting, because many people, when they feel lost, they want to go back to their roots. Some people go back to writing calligraphy and going back further. But a lot of people love reading that literature because it speaks to us now, because it's actually our modern, the roots of our modern existence. So it was a very short period of time. It was bursting with life. When you look at each individual work, okay, they might be not the best works of literature in all of humanity, but they mean a lot to us now here in China. And we're facing the same problems. We're facing the same problems all over again. So it's not necessarily that anybody has a definitive solution. It's about thinking about it in inspired terms rather than in dogmatic terms. And that's what we, as like when we're trying to live a creative life, that we're trying to avoid at all costs dogmatic ways of thinking and ways of living.
Thank you so much for inviting us over here. And thank you for this wonderful conversation.
Thank you.
Colin Siyuan Generate. And that's all the time we have for today. If you'd like to see more, try to find us World Insight. That's the name of our program. Or check out our YouTube channel. Follow us on Twitter and Facebook. I'm Tian Wei. On behalf of the team, thanks for watching. Bye for now.